Hello guys, so hope you're all okay. You're all enjoying your life and also you're enjoying practicing radiology and practicing ultrasonography. Today I'm going to focus on the breast imaging, especially when you are scanning the breast under the ultrasound scanner. So which type of important points you have to keep in your view. This is a very important. Many a time in the clinical setting we are using this ultrasound equipment for the differentiation of the breast masses and the breast lesion, but we forget some important points to take into account. Like if you focus on certain important points, it will help you to identify whether the lesion is benign or lesion is malignant, whether the lesion is solid or lesion is cystic. So these all useful information can be gathered on the ultrasound imaging. So what these points are, I will discuss that in length, which will include like shape is very important, the size is another criteria, the alignment is the third criteria. Then you have to look for the posterior effects, for the lateral shadowing, and on the top you have to look for the calcification. However, calcification cannot be seen on the ultrasonography. The best modality is the mammograph, but still to some extent, if you are expert clinician, you will be able to gather all these informations on the ultrasound imaging. So how it will appear on the ultrasound imaging, how we will look for all these important points, this all has been already discussed in this video. I do hope that this will be a very useful video for you. So let's start watching these narrations and these images. To differentiate the benign lesion from the malignant lesion, you should have to keep these few points in view to differentiate whether this lesion is looking benign or this lesion is looking malignant. So the topmost is the shape. You should have to concentrate on the shape, and if the shape of the lesion is oval or ellipsoid, this is usually benign, and if it is malignant, so the shape would be a bit variable with the irregular margins. You have to look for the alignment and different margins, and then you have to look for the ecotexture. You have to look for the homogeneity, whether it is uniform or non-uniform. Then the lateral shadowing should also be looked for, and the posterior effect as well. Some other sign which really contributes these are calcification and microlobulation and intraductal extension or infiltration. So all these points I'm going to discuss one by one with the ultrasound pictures and images. I do hope it would really help you to understand and to differentiate the benign lesion from the malignant lesion. So let's start. The first important criteria to differentiate between the benign and the malignant lesion is the shape. You should have to pay attention to the shape. If it appears to be oval or ellipsoid in shape, it's more towards the benignicity. Here on this image, you can appreciate this a well-defined lesion. So far, the shape is concerned, it looks as it is an oval in shape, or in other words, you can call it as an ellipsoid. So this is a purely benign lesion appearance on the ultrasound and ultrasound imaging. So this is the one of the important criteria you should have to keep in view. Just to have a look for the another criteria, and that is again the shape, but it is happens to be round. So round in shape, and this criteria looks like this is a more benign. The one another pointer, it's showing that it has some extension towards the skin surface. This is one of the characteristic of a sebaceous cyst. If there is any sebaceous cyst, it's trying to ooze out through the skin by a small defect, but this is what all we call it is a round cystic lesion, and it is mostly benign in nature, and there is no malignant potential in that. So on the ultrasound imaging, if you come across either oval or round in shape lesion, consider it as a benign. For the next, you have to look for the alignment. For the benign lesion, the criteria of the alignment would be that it would appear as a wider than deeper. So align parallel to the tissue planes. If the lesion is aligned parallel to the tissue planes, it's mostly benign lesion. But if it is deeper than wide, so think of malignancy. Here on this ultrasound image, both alignment has been shown. Towards the right, if you concentrate, you can see that this is more wider than deeper. So the first thing is shape. You can see the shape is oval, and so far the alignment is concerned, it is more wider than deep, and it is parallel to the surrounding tissue plane. So it's mean it is benign lesion. Now compare it to the left one. On the left side here, you can appreciate in view that this is deeper than wider. So the lesion is deeper than wider. And the second thing is it's neither oval nor round. So it's in variable size. So this is one of the characteristic of the malignant lesion. So if you see the lesion like this, consider there is a chance of malignancy. This is again the alignment here. I wanted to try to show you alignment here. The alignment is deeper than the wider. So the more penetrating downward deep in the parenchymal tissue, it is the characteristic of the malignant lesion. The next point which needed to be concentrated on is the margins and smooth margins versus irregular margins. So for the smooth margins are concerned, happens to be thin echogenic pseudocapsule with 2 to 3 gentle lobulation. It would be the benign lesion, and in the malignant lesion this would be either irregular or would be speculated or maybe echogenic hollow surrounding. So that would be considered as a malignant lesion. So here on this particular images, so on the right side, what I would say, however, it is slightly deeper than the wider. The first thing is. The second thing is, so far the shape is concerned, it's slightly oval in shape. But if I talk about the margins, I could see that there is slightly irregularity with having a slightly surrounding echogenic hollow, which makes it fall in the category of the malignant lesion. And if you look towards the left side, so if I comment on the size, on the shape, so again I would say it is a variable shape. If I comment on the alignment, I would say it is deeper than wider. And if I comment on the margins, so margins are fairly regular, and to some extent some of the margins look like speculated within the parenchyma. So this makes it suitable for the malignant lesion. So these two images which are in front of you are the ultrasound imaging, and these both imaging in one way or the other looks malignant lesion. So if you come across such lesion, comment on its shape and on its alignment and on its margins, and give your suspicion that this is more like a malignant lesion. Ecotexture should also be taken into account while differentiating between the benign and the malignant lesion. If ecotexture is variable to intense hyperechoic, it is usually seen in the benign lesion. So if the lesion is hyperechoic, so that is a benign lesion. But if the ecotexture is with a low level or markedly hypoechoic, you must consider the malignant seen within it. On these four ultrasound images, I'm trying to explain the ecotexture beside the size, and particularly I will explain the ecotexture of the benign and the malignant lesion. So look for the first top image of A, and that is slightly towards the ecogenicity or echogenic. So this is not the suitable for the malignancy. Look for the B. It is although slightly hypoequic, and this will fall within the category of the malignancy because of the two factors. The one is it has an irregular margins, and the second thing is it's markedly or predominantly hypoequic. If you come down towards the left side, still I would say this is an ecogenic lesion, and it favors mostly a benignicity and the benign lesion. But if you look for the right-sided lower image, this is markedly hypoequic, predominantly hypoequic lesion, which making it suitable for the malignant lesion. With respect to benign and malignant lesion on the ultrasound imaging, the homogeneity and the internal echoes play a vital role. If the homogeneity is uniform, that would mostly be or likely be a benign lesion. But if it is non-uniform or there is something within it, so that would be considered as the malignant lesion on the basis of ultrasound imaging. Look at this lesion. It is a bit magnified view, so just to make you understand that this is to some extent called as an homogeneous. Although it is not fairly homogeneous, but comparatively I could find this slide on the internet. I just presented it to you that for the explanation of the uniform ecogenicity. So I would consider it as a uniform ecogenicity. So this is most favorable for the benign lesion. Have a look to these two images. On the right side, again I would say I'm just discussing about the homogeneity. So towards the right it is slightly homogeneous, and it is uniform, but towards the left side it is non-homogeneous, non-uniform, so it will fall in the category of the malignancy. So these two lesions showing you the homogeneity, uniform homogeneity and non-uniform homogeneity, making it benign and malignant respectively. With respect to benign and malignant lesion on the ultrasound imaging, the next important factor is the posterior effects. You have to look for the posterior effects, and if it is minimum attenuation and posterior enhancement, so it will show that the lesion is benign. But if this attenuation which is obscuring the posterior margins of the lesion, this would more likely be malignant lesion. So this slide beautifully explains the posterior effects. Here you can see that the attenuation from the lesion is completely obscuring the posterior margin. You are unable to see the posterior margin. That is because of the attenuation. So this is more favorable for the malignant lesion, and this likely to be a malignant lesion. So therefore the red flag should be alert, and it's needed to be FNAC'd, and you advise that it should be biopsies and excised. Again, have a look to this lesion. It is multifocal, like there is two lesions in that. The smaller one is just developing, and the larger one, it is again with the posterior effects. So attenuation and from the lesion is obscuring absolutely the posterior margin. So you are unable to comment on the posterior margin of the lesion. So it makes it more favorable for the malignant lesion. Beside all these above factor which has already been discussed, it is important to look for some other signs as well. The most important one is the calcification, microcalcification. You have to look for the microlobulation, intraductal extension, and also infiltration across the tissue planes are important points needed to be noted. With respect to the calcification, look at this image here. to some extent you may be able to appreciate the calcification. Microcalcification is one of the important point which started ringing the bells, and it will suggest that this lesion happens to be a malignant lesion. So therefore, whenever you are scanning, always focus on the presence or absence of the calcification, and always put on your report whether there is some calcification or not, or whether there is some cystic lesions or not. But particularly with the calcification, you have to comment on it. Here on this second image, you can also appreciate a tiny calcification. This is an example of the microcalcification, which is again making it favorable for the malignant lesion. So do not forget that, and always comment on the calcification. Here on this, you can appreciate that some sort of a wall calcification is there, and which is making it favorable for the malignant lesion. I do hope on this video I have discussed everything at length to make you able to differentiate between the malignant lesion and the benign lesion on the basis of the size and shape and alignment and calcification and ecogenicity. Still do hope that it would be a worth watching video, and you may be able to differentiate the benign and malignant lesion on the ultrasonography. So keep watching my video, keep sending me comments, and share with others as well for the information purpose. Thank you very much.